Hey guys, it's Louis here from ndxtesting.com, the channel where we try to give you medical digitized information so that you can make good decisions for yourself, and perhaps you can consult with your doctor, your physician, your consultants, and you can make adequate decisions when it comes to your healthcare. Now, in today's video, we're going to speak about anxiety and high blood pressure. Now, we're going to speak about how I was able to manage these symptoms successfully. Now, I've released a couple of videos in the past how I speak about how I was able to cure my high blood pressure and anxiety, and also how I never used to suffer from these things. I mean, the first time I ever that I found out I had high blood pressure and anxiety was 2017. Before that, I think I went to a little episode, I think in 2008, I did one time had high blood pressure. I think it was 160 over something. I had a little bit of anxiety too, and but it went away. You know, I was much younger, of course, and I used to dance a lot and used to go out a lot, just live a completely different life. And I think I had it for about 2 weeks, and I didn't go to the doctor. I think I spoke to my mother about it, and she gave me some natural remedies. I don't remember what they were. I think it was like Q10 pills, some garlic pills, and I took them. And 2 weeks later, I mean, I went out for some walks, and like I said before, I used to dance a lot, so it quickly went away. I never felt it again. I even completely forgot about it. But in 2017, whatever was causing, whatever was the root of the cause, because there's always a reason, there's always a root, there's always a why things are happening. Things just don't happen because most people think, oh, you have a genetic disposition, and if your mother has diabetes and high blood pressure, well, you're going to get that. Now, it's partially right. I mean, if you do the same thing your parents do, and if you eat the same way they do, and if they have diabetes, well, you're going to get diabetes too. I mean, sometimes it can be a genetic disposition. For instance, I'm a medical technologist, and I see patients for a living. I do nerve examinations, and my specialty is the peripheral nervous system, so I specialize in nerves and muscle. And sometimes I have seen patients that have told me that they had a genetic disposition when it comes to, let's just say, diabetes. Well, they told me that they had diabetes ever since they were 10 years old. That's a genetic disposition. But when you're 20, 30, and all of a sudden you're in your 40s and you end up with diabetes, that is not a genetic disposition. Whatever it is, you did it to yourself. But anyway, that's another video. But anyway, so when I found out that I had high blood pressure and anxiety, I expect at least to know why. Right? So then when I went to the first doctor, the doctor couldn't really tell me why. But of course, then we did a bunch of exams. We did some blood work, and we had some EKGs, just the general exams. The blood work came out clean. And then I went to another doctor a couple of months later, blood work again. Blood work came out clean. Now I have a cousin. He's a technologist when it comes to cardiovascular. So he did ultrasounds on me. He did general ultrasound. He did vascular studies where they look at your arteries and see if there is a problem. I had kidney exams. I had echoes. I had a lot of different tests. I even saw later on, I saw a cardiologist. But anyway, I did every single study that you can think of to find out why I've had blood pressure and high blood pressure and anxiety, and I couldn't really find out, and no doctor was able to tell me why. But anyway, also the purpose of this video is to just tell you guys how I was able to manage my high blood pressure and anxiety, because I think that if I didn't step in, if I didn't believe, right, that there had to be a why, that there had to be a reason, that there had to be a root cause, I still would have been taking medication now. I would have been in anxiety pills, and I would have been taking high blood pressure pills. The high blood pressure pills, I mean, you don't feel anything when you take them. I mean, there might be some side effects, but the anxiety, you do. Depends what you're taking. I mean, I took a couple of strong ones, I think maybe Xanax once or twice. I didn't like the way that made me feel. that the ones they did prescribe to me, they weren't that strong, but I still didn't like the way it made me feel. Anyway, but the point is, I can't imagine that I will be on medication now and not knowing why I was feeling the way I was feeling, or believing the doctors saying, well, you're 40-something years old and that's what life is all about. Maybe you get it from your father, or maybe you get it from your mother. They didn't know why. But their why was, you don't have to have a reason. There doesn't have to be a reason why you have high blood pressure and why you have anxiety. That's just the way life is. That was their explanation. So their explanation was no explanation, no reason why. I refused to believe that. I also caught a panic attack one time. I woke up suddenly in panic mode, like someone throwing cold water at me, and you just wake up suddenly. I woke up gasping for air, and I took my blood pressure sky high, 180 over 110, and my heart rate was extremely high. And when I was going through my anxiety situations, my heart rate was, sometimes high, over 100. I was always a little nervous, worrisome. I mean, it wasn't something that it was ever overtaking my life, but it was something that I was constantly thinking about. And I would do lots of things. Of course, I would dance, jog, I would do exercises, I would go play tennis, I would go play golf. I mean, I wasn't letting this thing, I was trying to beat it. Because there's always things that you could do. You have to be able to treat the symptoms. Sometimes at the very beginning, when you don't know what's going on, I mean, you got to take some sort of medication. Because the truth of the matter is that when you take vitamins and when you use natural remedies, it does take a little bit of time. So at the beginning, I think that it's important that you do take some medications. And I'm not anti-medication. I'm just anti-taking medication continually, not knowing where the problem is coming from. But anyway, I still believe that there had to be a reason, and thankfully I was able to find out why I was suffering from anxiety and why I developed the high blood pressure. So when I found out that why I was having this anxiety, it took about 2 years. I mean, I can't say that I suffered a lot, but I could say that I went through a lot. I mean, I wish that I would have been able to see a video. I wish I was able to see someone just speak to me, and instead of just saying, this is just the way it is. I mean, you don't have to have a reason why. So no matter what happens to you, no matter what you're going through, there has to be a reason why. I mean, sometimes you do know. Sometimes people have high blood pressure because they have diabetes or they're overweight. They take care of the obesity. They take care of whatever it is you need to do, then your anxiety goes away. Sometimes it's just decisions that you make. I think maybe about a month ago, I caught a little bit of anxiety, but I was worrying about something. We were doing some construction in the house, and I just caught a bad feeling about things that were going on. Things were kind of going south a little bit. Although everything worked out all right, I caught a little anxious, but I knew why. He was mental. But what was going on before was not mental. Okay, so when I ended up going into the hospital because I caught a panic attack, they did every single test. I spoke to different types of doctors, and I figured that they were going to tell me why. And then their solution was, their diagnosis was that it was mental. I was having some radical mental disposition, and I needed to see a psychiatrist. And I told them, listen, it's not my mind affecting my body, it's my body affecting my mind. I know myself, and I have never suffered from anxiety. I have never suffered from depression. So anyway, so I was completely dismissed. No one could tell me why. And what I found out, how I found out what was going on with me, is because 2 particular patients that I saw, they were having the exact same symptoms. Now, my symptoms were a fast heart rate, and I always had a nervous feeling in my body, I don't know how to explain it, but I was always worried, and I don't know what I was worried about. I mean, I married, 2 kids, life was good. I have a good job. I support my family. My wife stays at home and she takes care of the kids. I mean, I didn't have any stress whatsoever. We live a good, simple life. We make good, adequate decisions. We don't try to do too much. You know, we work hard as a family, but there was no reason why I should feel stress, or I should feel that I have an anxiety, and I was going through it. I had a fast heart rate, and I don't know why my heart was racing, and also the high blood pressure. So, and then obviously I was developing a little bit of insomnia at the time back in 2017. I was waking up in the middle of the night, suddenly gasping for air. So something's going on in my sleep. Okay, but I didn't know. So those same symptoms describe one of my patients, and that particular patient said that she had sleep apnea. I didn't know what sleep apnea was at that particular moment. Okay, I know what sleep apnea was. That's not what I'm trying to say. I didn't know the symptoms of sleep apnea. I have to correct that. So then I saw another patient, you know, and the same thing. But then this time the patient told me that he sleeps with a CPAP machine, because if not, he just wakes up. He needs that machine. If not, he wakes up every 5 minutes. But he was overweight. He had a lot of fatty tissue, and I was like, wow, you know, I have these same symptoms. Can that be? But I told the doctor that I work with, and I also told the acupuncturist that I work with, and also the physical therapist, you know, and they were like, "Well, but you're not overweight." Because a lot of people that have sleep apnea are overweight. They have a lot of fatty tissue, or they have an obstruction when it comes to their breathing, and I wasn't going through any of that. So I really didn't know why that would be affecting me. They were like, "No, it's impossible. You do not have sleep apnea." As I kept on digging, I discovered something, and I discovered that all my life, pretty much when I was asleep, I will mouth breathe. And I discovered that mouth breathing is a silent epidemic that is affecting the lives of millions of people. So if you mouth breathe over time, okay, it can increase your blood pressure. It increases your heart rate. It gives you anxiety. You could develop some sleep apnea. You can develop diabetes. You could develop a lot of problems. You also develop an overbite. You develop gum disease. You develop gingivitis. And I discovered that it was because for most of my life, that was mouth breathing. Mouth breathing is not good. So the very moment that I discovered that mouth breathing was causing my symptoms, I automatically changed. I started sleeping in a different position, 2 pillows, elevated. Anyway, I did some research, right? And I started sleeping correctly, and I started breathing through my nose automatically. The very next day, I'm telling you, I felt 70%. Can't say I felt 100%, but I used to wake up anxious every single time. I used to go to sleep okay, and I would wake up anxious. When I had the panic attack, I would wake up anxious. And I remember throughout the years, and it started back in, I think, 2007, sometimes I would wake up suddenly gasping for air, like what the heck's going on? Like if I can catch my breath, I'm going to faint. And I never knew why. That would happen once a year. But then it started back in 2017, it started happening a little bit more often. And I remember when it peaked, I think for 3 days I didn't sleep. I slept maybe like 3 hours or 4 hours in 3 days. And I went to work. This thing was getting the best of me. I didn't know why. So I started piecing things together, and I was like, wow, you know what? Mouth breathing. You can't breathe through you can't breathe through your mouth. You have to breathe through your nose. I mean, listen, there's a lot of people, sometimes they have problems. They can't breathe through their nose. But if that's the case, then you have to go to an ENT doctor, and you need to check to see if you have any obstruction, okay? when it comes to you, if you have any breathing obstruction going through your nose. Okay. Anyway, so once I found out that mouth breathing was causing all my problems, and then mouth breathing was causing low levels of sleep apnea, not high levels. There was no reason. I went to an ENT doctor. They checked. I didn't really have any obstruction. I didn't have. At one time, the first time I went, he told me I had some sort of mild deviated septum. I just recently went to him again, no deviated septum. The reason I went back to him recently is because I had a sleep study. I'm going to speak about that just slightly, a little bit. Now, I don't want to prolong this video too much. And the objective also of this video is to, answer. Somebody would ask me a question on the video. They wanted to know that if I found the root cause of my high blood pressure and anxiety, why was I still taking medication? The patient felt kind of disappointed that they're coming to my channel to find out how I was able to cure my anxiety and high blood pressure, and yet I was still taking medication. Now, there's one thing that I wanted to point out. See, I don't want to be anti-medication. Okay, I don't want to come across like, oh, do not take medication, because sometimes we do. When we do not know the problem, we need to take some medication, okay, until we find out what the problem is. Once we find out what the problem is, then what we do is tackle the problem. That's what I did. I was able to tackle the problem. Now, the anxiety went away pretty much overnight, okay? So I stopped taking the anxiety pills pretty much right away. The high blood pressure, I also stopped taking it. But one time I took my blood pressure and I realized, you know what, it was still high. So sometimes when it comes to blood pressure, we need to understand that when we have high blood pressure, our arteries get narrow. And sometimes they take a little bit of time for them to get wider, so the blood can flow. I guess that was, my situation. Sometimes things can take a little bit of more time. So the point is this: just because you find out the root cause of the problem doesn't mean that you can automatically get off the medication. Sometimes things take a little bit of time. Now with the anxiety, it went away pretty much instantly. Within a week and a half, I think 2 weeks, I felt 100%. Every time I wake up now, I feel 100%. My body now, it's in a good place. I remember the way I used to feel in my 20s and 30s. I don't feel any different as far as my mind and as far as my body. Obviously, there's things that I can't do anymore. I'm 53 years old, so I can't climb and I can't run and I can't dance. I don't have that type of energy. But as far as stress and as far as being comfortable and as far as being confident, I feel okay. I mean, I have a medical company and I see patients for a living. So, I have a technician that works under my supervision. I have a YouTube channel. I'm a content creator when it comes to TikTok. I'm putting together a social media marketing company. So I'm doing a lot of different things. I'm also creating some new nerve conduction study applications so I can teach people how to do nerve examinations. So if I was feeling the way I was feeling back in 2017, I would not be able to do or think or function the way I am now. But because I feel 100% and I was able to manage my anxiety and high blood pressure, then I'm able to function and I'm able to think the way I used to when I was a younger person. So the point is this: it's important that you find out always the reason or the why you have anxiety of high blood pressure. Because when you don't know and you are taking medication, right? And you have the root of the problem, the root of the problem causing the symptoms, okay, affecting your body, and then you're taking the medication. I mean, it's a tug of war. You don't know who's going to win, or you don't know if the medication is going to work. That's why there's some patients who end up taking one medication and then they switch to another medication and then a third medication just to go back to the first medication because it's not working. Because whatever the root of the problem is, you're not finding out what the problem is. You're not tackling that root cause. So when you find out the why or the reason, then medication will be able to work a lot quicker. So if I was still on meds, that means that I would still be mouth breathing. And if I was mouth breathing, then I am pretty much damaging my health. And the doctors were not telling me why these things were happening. But because I stopped mouth breathing and I started breathing properly and I started sleeping properly, my anxiety went away. And then sometimes the blood pressure, it can take a little bit of time. I can only assume that maybe since 2008 I've been mouth breathing and I've been putting pressure on my cardiovascular system, and who knows when my arteries started to get narrow, and all of a sudden I developed the high blood pressure because of the mouth breathing. I mean, just look it up the implications of mouth breathing, and you're going to know that it's not good for your health. So now, obviously, I don't take any medications, at least for anxiety. I haven't taken any medications since 2017. The blood pressure has been sometimes off. Now, I don't have any other problem. I mean, I remember one time speaking to the doctor, and he kept telling me, this is years ago, back in 2017, stop thinking of a sinister way why, or a sinister explanation of why you have high blood pressure. I was thinking it was my kidneys. I was thinking the worst. I'm thinking I'm going to die. I have cancer. I don't know what. I was just thinking all kinds of stuff. I just didn't know why I was feeling the way I was feeling. So obviously I did every single test on the book. I just recently had a sleep study because it got approved. I had a home sleep study by a company called Home Sleep. It was the most amazing thing in the world. It's a little gadget. You put it right around your chest. Okay, and then you have a little apparatus that wraps around your ear, and you put it on your nose, you go to sleep, and it gives you a complete sleep report. And it tells you the levels of sleep apnea that you have. Now, obviously, one of the reasons that I also developed a little bit of a breathing issue, right, because I have an overbite. So when you have an overbite, your airways get a little bit narrow, and you have the tendency of opening your mouth. Okay, but I would, with training and everything, I know how to sleep in a good position where I don't open my mouth when I sleep. But anyway, the bottom line is that I was able to manage my anxiety and my blood pressure. And I think that if you have anxiety and high blood pressure, you can manage it too. There's going to be a different reason. But I'm telling you that when you know where the problem is coming from, if you have anxiety and high blood pressure and you know where the problem is coming from, that's a different situation. But when you don't know why you have anxiety and why you have high blood pressure, there's only two hidden reasons. Mouth breathing, okay? And that happens to the majority of people that have an overbite, or maybe some that are overweight and they have fatty tissue and they can't breathe. Another one is called visceral fat. Visceral fat is when you have unnecessary belly fat, compromising your organs, compromising your liver. Okay, that when you have unnecessary belly fat, it affects your cardiovascular system and it releases toxins into your body. And then you go to the doctor and you have this belly, right? And the doctor can't pick up and tell you, Mr. So-and-so or Mrs. So-and-so, you have visceral fat and you have unnecessary belly fat, and that is the reason why you're probably developing diabetes, high blood pressure, and anxiety. I mean, just look it up. Two hidden reasons. I didn't have any visceral fat, but I was a mouth breather because I had an overbite. But anyway, guys, I think we're going to end this video here. Now, I haven't posted a video in about 70 days. I mean, that's a very long time. And the reason of that, I mean, I was having some construction in the house and I've been doing a lot of other things, but now the construction has stopped. It stopped about two weeks ago. And I have a new schedule. I have a lot of things going on, but I'm going to post more videos on this channel, and we're going to introduce a lot of different medical components. We're going to make new videos when it comes to anxiety, high blood pressure, I want to speak about a lot of different things that are interesting, provide you guys with medical, different types of medical information so you can make good decisions for yourself. Anyway, I hope this video it has been helpful. I hope I've answered a couple of questions. But again, the bottom line is, just because you find out the root cause of the problem, it doesn't mean that you can get off your medication, but it means that the medication will be able to work a little bit more effectively, because now you know, now you're tackling the problem. Okay. I also wanted to mention, obviously, when I was tackling the problem, I was using also natural components like I do now. But anyway, I'll see you in the next video, and with that being said, bye bye.